Our job, and our healthcare workers do a great job at it, is to provide comfort where comfort is needed. And that's what they're doing. And yeah, that's heroic. So the challenge was, of course, we just didn't know a whole lot about COVID-19. The first thing that I did that was so outside of my normal scope of practice was to try to come up with a predictive model for a pandemic no one had seen coming. Even the best case scenario had Maine needing to use upwards of 1,000 ventilators at any given time. And yet across the state, we only have between 350 and 500 ventilators. And so it was very important for us to reach out to all hospitals across the state and say, what can you provide if this actually happens?
I got a call from Dr. Jarvis that he was looking at doing a community tent and if I could help participate with that. So very quickly, it all happened in overnight. My life changed to organizing a tent site for swabbing of patients with COVID-19.
In less than a week, I went from, okay, keep an eye on this, to you need to expand your unit as far as you can and be prepared to take as many ventilated patients as we could possibly take. We pulled from all of those areas that were shut down, and all of those managers pooled their staff, and we started cross-training.
The first 2 weeks I was assigned to Swab and Go. My main role was to teach the donning and doffing, how to use our PPE, our protective personal equipment. I was responsible for getting the patients assigned to a provider in the system, the 1-800 number, getting them in, getting them swabbed. At first, it was honestly scary to me, and that was one of my fears, bringing something home. Going home normally, my boys would run to me and want to touch me, and I want to see them, but my husband and I found a secret way for me to get into the house and shower and change, and the whole process takes a long time, but I want to be safe.
It's very scary, but it's also my job. And I struggle sometimes to communicate that to my kids, but I have the utmost faith in my team. I know my manager has my best interests as a human at heart.
We have been called on by long-term care facilities, homeless shelters, and other groups that need help with symptom surveillance and rapid testing of these folks that may have been exposed or are at risk of having COVID-19. When we're out there, we are wearing full PPE. It's really exhausting to wear this. It affects how we breathe. You know, your glasses fog up, everything else. The sheer volume of it can be exhausting.
One of my patients was one of the first to pass away in the state. And when you have your patient that you've been through ups and downs and you know how strong they are, and then to have them succumb to something that feels like a curveball that life threw you, that it feels unfair. I allow myself however much time I need to step away to grieve that patient, that moment, that relationship, and then I really just focus on what can I do to help somebody else? What's the next step?
There are times when my anxiety level gets up there, particularly when it's something that we know urgently has to be done, and yet we have to make sure that what we're giving from an information standpoint is accurate and useful.
The frontline managers make sure that the staff are taken care of. So if there's ever a question, the first concern is, are you okay? What can we do for you?
Our natural inclination is to help wherever we can. We all have appropriate PPE. More than not, I've heard that everyone feels safe.
My fear is not where it was, so I felt really supported in that way.
It's a community that's tight-knit, and we'll get through it together.
One of the joys that I've had during this time was just somebody randomly driving by, lowering their window and saying, "Dr. Jarvis, how are you doing?" That sense of community that Mainers have to say, we just need to make sure you're doing okay because we appreciate what you're doing. And I've been trying to convey that same message to our frontline workers, that that's the sentiment out there. they're heroes because they're putting themselves in harm's way in order to take care of people who they don't know.
I think that we all have to just remember that we're in this together, and we should be thankful for the efforts of all.
Being able to recognize when somebody on their team is having a rough day or a rough couple days, and we are great at surprising them with their favorite candy and their favorite coffee. We work as a family.
This is a community effort. I can't just not go because it's scary. There are people that still need help, and our job as community members is to help them.
I don't feel like I'm a hero. I feel like this is what I signed up for, and this is what happens.
This is a hard time, but I don't think I'd want to be anywhere else in the middle of all this.